Therapeutic exercise may be the most effective technique in physical therapy. Unfortunately, many therapists prescribe the wrong exercises and this leads to poor results. That's why in this program, all the exercises are evidence-based, and what's more, they possess 4 key features. First and foremost, these exercises use the proper amount of reps and sets. This is going to optimize your strength gains while minimizing injury. Second, these exercises target the specific muscles that research shows to actually benefit the joints. Keep in mind that strengthening certain muscles can actually be harmful to the joints, so you need to know which muscles are actually therapeutic to strengthen. Third, these exercises use movement patterns that create the optimal amount of joint space to avoid wear and tear. That is to say, these movements do not cause excess friction within the joints. And fourth, these exercises don't require the use of much weight or resistance. EMG studies show that many of these exercises elicit great muscle contractions without the use of weight. Therefore, heavy weights are often not required in order to gain strength with these exercises, and strengthening with little to no weight will decrease the risk of damage to your joints. While you want to gain strength, you don't want to sacrifice the health of your body in the process. So let's take a look at the program. First, I'd like to highlight that you should not push into pain with any of these exercises. And prior to exercise, you need to take your resting heart rate, blood pressure, and oxygen saturation. If it's outside of this range, see a medical doctor before attempting any exercise. When choosing how many reps and sets, I suggest 4 sets of 12 reps 3 times per week for most of the muscle groups. With your glute muscles, it's hard to completely isolate your gluteus medius from your gluteus maximus, so I suggest 2 sets of 12 reps for each specific gluteal muscle. Otherwise, 4 sets of 12 reps per muscle group should achieve the best strength gains and therapeutic benefit. Let's take a look at the everyday exercises, starting off with the psoas stretch. First, you need to split your stance until you feel a stretch on the front of your back leg. This stretches your rectus femoris muscle. Next, punch your hand up into the sky as high as you can and tip your torso back. This stretches your psoas muscle. A tight psoas can cause back, hip, and knee issues, so it's very important to stretch. And hold each stretch for about 30 seconds and up to 4 minutes, after which there is a diminishing return. Let's move on to the hamstring stretch. You lay on your back and use a belt strap to elevate one leg. Keep a slight bend in the knee to avoid stretching the sciatic nerve. The goal is to isolate your hamstring. Again, hold for 30 seconds to 4 minutes. And please note that you should never bend over to touch your toes while you're standing. This may stretch your hamstring muscles, but it's also a mechanism of injury for a ruptured disc. So laying on your back is the preferred method to stretch your hamstring. Next, we move on to core stability. Contrary to popular belief, you want stability rather than strength in your core. Let's take a look at the mini curl up. Lay on your back with your hands under your low back and one leg bent. Raise your head, shoulders, and chest off the ground just high enough so you could slide a sheet of paper under your head, no higher than that, and you'll feel a contraction in your abs. You hold each rep for about 8 seconds, but not much longer or you could cause a muscle spasm. You relax for a full second between each rep and then you switch legs each time. With side bridges, you should start out on your side with your knees bent. Go ahead and thrust your hips up and forward while resting on your forearm. You'll feel a contraction in your obliques. Again, hold it for about 8 seconds. Relax for a full second in between reps. With bird dogs, you're going to need to get on your hands and knees, drive a fist forward and your opposite foot back. Create tension in your body from your fist to your heel. Again, hold for 8 seconds, and you can relax in between reps or you can sweep the floor as you see in this video. And with all of these core exercises, I suggest a rep scheme of 6 reps, then 4 reps, then 2 reps, and about a 30-second rest in between. This takes us to our Monday, Wednesday, Friday routine. With many of these shoulder exercises pictured here, we're targeting the anterior deltoid. It's important to target this muscle because it takes the stress off of the rotator cuff muscles. And the anterior deltoid is best isolated when you lay on your back. So with the beginner version of the exercise, you lay on your back with your elbow bent. Having the elbow bent places slightly less torque on the anterior deltoid, but allows you to start utilizing that muscle. If you need some more resistance, you do the same movement with the arm straight and the thumbs pointed up. If the thumb is pointed down, you're going to be using your rotator cuff muscle. If the thumb is pointed up, you're going to target your anterior deltoid. And once you're ready to progress from there, you can incorporate a TheraBand under your legs, holding with both hands, or some dumbbells. And with all of these exercises, I suggest keeping the thumbs pointed up, and you can remember this by thinking thumbs up to shoulder health. I also suggest that you do not surpass 90 degrees, and you can ensure this by making sure that your arm does not surpass the height of your shoulder. With all of these exercises, make sure you're concentrating on the muscle on the front of your shoulder. Make sure you're going through the motion nice and smoothly, taking your time, and you're not pushing into any pain. The goal here is to fire your anterior deltoid and to make that muscle the primary mover of your shoulder when performing elevation. This way your body can learn to use your anterior deltoid instead of stressing your rotator cuff muscles. Next, we have a group of exercises that strengthen your serratus anterior. With each of these exercises, it's important to note that the movement does not come from your elbows. Your elbows should remain in the same position throughout the movement. The majority of the movement comes from your shoulders and your shoulder blades. You thrust your shoulders forward and concentrate the contraction in your upper back. Then you draw your shoulders back by pinching your shoulder blades together. Your elbows should not move the entire time. Your shoulders and shoulder blades create the movement. You can start by laying on your back and punching your fist up into the air, or using a dumbbell with this movement. You can progress by leaning your forearms into the wall, and from there you can progress by doing the same exercise in a plank. For athletes, a push-up plus is an even more advanced version of this exercise. Now we have some leg exercises to discuss. These next exercises are going to target your quadriceps muscles, the muscles on the fronts of your thighs. The beginner exercise is called a short arc quad. You can perform this while you're laying down or sitting up with your legs out in front of you. Just place a small pillow or a bolster under your knee so that you have a slight degree of bend in your knee. And then you're going to fully straighten the knee while you're contracting that muscle on the front of your thigh. From here, you can progress to mini squats. I suggest performing mini squats with a chair directly behind you and in front of you a grab bar, a counter, or a walker for safety. Start off by coming to a full stand and then very slowly descend part of the way down. Don't go all the way down, go slow, not low. You go slow on the way down and you come back up at a normal speed. The lower you go, the more compression you place on your knee joints, so you don't need to descend all the way down. Instead, go slow, not low. This way you stress the muscle metabolically instead of stressing the health of your joint, and this also focuses the contraction on the vastus medialis, which is the most therapeutically beneficial quadriceps muscle. If you're ready to progress from here, you could perform single leg squats. I suggest that you grab a hold of a chair, a grab bar, counter, or walker. You're going to kick one leg back in a straight line with your spine. While standing on the other leg, very slowly descend part of the way down. Once again, you want to go slow, not low, and come back up at a normal speed. Having the opposite leg kicked out behind you is going to create more core stability. So you're taking an exercise that usually causes low back pain and you're turning it into an exercise that improves the health of your back, while also stressing your vastus medialis. You may also use a TheraBand behind the knee for added resistance with this exercise. Next, we have the exercises for Tuesday, Thursday, Saturday. There's one exercise here that targets your middle and lower trapezius muscles, and it's an excellent exercise. This is the supine band pull apart. Make sure to perform this exercise with your thumbs pointed up while you're laying on your back. It's important to perform this exercise while you're laying down, because if you perform a standard gym row or a low row, it's actually going to incorporate your upper trap, and strengthening your upper traps can throw off the movement mechanics in your scapula or shoulder blades and lead to impingement. So this exercise allows you to isolate the contraction in just your middle and lower traps. Make sure to keep your arms and elbows completely straight and create the movement with your shoulders and your shoulder blades by pinching your shoulder blades together as you pull the band across your chest. Then slowly return to the starting position. Next, you have a couple exercises to target your teres minor. It's an important muscle to target because while it is a rotator cuff muscle, it is the one rotator cuff muscle that is rarely injured, and strengthening this particular rotator cuff muscle can help relieve stress on the more injurious rotator cuff muscles. In fact, strengthening your teres minor in combination with your anterior deltoid create the same exact force vector as your rotator cuffs collectively combine. So if you perform your exercises for the anterior deltoid in combination with your teres minor, you're going to greatly relieve the stress on your rotator cuff. The most ideal version of this exercise is the one that you perform laying on your side. This is because it isolates the teres minor the most. However, it can sometimes be uncomfortable for certain patients to lay on their side when they have a shoulder issue. That's why I also give you the option of laying on your back and utilizing a TheraBand to perform the movement. With each of these exercises, make sure to keep your elbows bent and maintain a 90-degree bend throughout the movement. You're creating the movement by rotating your shoulders outward. Your elbows should remain pressed across your body and act as the hinge of a door. The movement occurs in the shoulders and should mimic a door opening and closing. Focus the contraction on the back part of your shoulder. And I would keep the weight fairly light with this exercise. It's a small muscle that you're targeting, so you definitely don't need anything over 5 pounds. On a side note, you may also place a towel roll between your elbow and your body for added comfort as needed. Next, we have 3 exercises that target your gluteus maximus. The first exercise is a bridge. You basically lay on your back with your knees bent. You first tighten your buttocks and you make that muscle carry you through the movement as you raise your hips up into the air. You hold it there for about a second, then you return to the starting position, relax, and repeat. If you like, you can add a weight on the top of your hips for added resistance. From here, you can progress to hip extensions. You're going to stand up, hold on to something sturdy. Once again, you first tighten your buttocks and make that muscle carry you through the movement. As you kick your leg back, make sure to keep your leg straight as you kick it back. Hold it here for a second and repeat. And with this exercise, you can utilize a TheraBand around the ankles for added resistance as safely tolerated. The final progression here is a front plank with hip extension. You're going to start off in a plank on your forearms. You're going to tighten your buttocks and make that muscle kick your leg up into the air. Once again, attempt to keep the leg straight. And if you're very advanced, you could use a TheraBand around both ankles or an ankle weight for added resistance. Next, we have 3 exercise progressions that target your gluteus medius. First, you have bilateral hip abductions. First, you're going to lay on your back. You're going to tighten your buttocks and use that muscle to carry you through the movement as you pull your legs apart like windshield wipers. You can hold it out there for a second and then come back in and repeat. It's important to keep your toes straight or slightly inward, because if you turn your toes out, this means you're compensating with your quad muscles. And here the goal is to target your gluteus medius, so keep your toes straight or slightly inward. And you can use a TheraBand for added resistance. You can also progress to standing hip abductions. I suggest you hold on to something sturdy. Once again, make sure you tighten your buttocks and force that muscle to carry you through the movement. Keep the toes straight or slightly turned inward. And the last progression is a side bridge with a hip abduction. You assume a side bridge position, thrust your hips up and forward while resting your weight on your forearm and feet. Tighten your buttocks, raise your leg up into the air. Attempt to keep the leg as straight as possible, toes forward or slightly inward. The gluteus maximus and medius are 2 very important muscles to strengthen. They're going to decrease your risk of low back pain, hip issues, and knee issues. Last but definitely not least, we have balance and cardio. I suggest trying to work up to about 20 minutes, 5 to 7 days a week. It's best to use a chair with armrests, but if you don't have one, make sure you hold on, and you're gonna tap the balls of your feet together and out in unison. To challenge your vestibular system, which is very important for balance, you're going to simultaneously turn your head left and right. If you want to make it even more difficult, you can close your eyes while doing so. Now, ultimately, it's best to challenge your balance while you're standing, but with this program, we want to make things as safe as possible, and this is one of the few ways you can safely challenge your balance while in the seated position. Make sure to work no harder than you are able to comfortably speak, and this will ensure the proper intensity level for an ideal cardiovascular workout. Pacing yourself with this exercise is key, and make sure to take all the rest breaks that you need. After the age of 65, falls are the leading risk of traumatic death, yet so few people target balance with their workouts, but in this program, I make sure to include it. Well, there you have it, the most evidence-based therapeutic exercise program of its kind. Make sure to consult a clinician before starting any exercise, and remember, work smart, not hard. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.